Okay, so let's learn postpartum hemorrhage protocol or generally an obstetric hemorrhage protocol. First of all, it includes to initiate obstetric hemorrhage protocol. First step is call for senior help. Second step includes scribe to clearly document timing of events, people present, and interventions administered. Then comes uterine compression or rub up contractions, such as uterine massage, empty uterus and vagina of any clots, empty bladder, uterotonic agents, and this is a very important step. Seventh step includes bimanual compression of uterus if atony is the cause. Then intravenous access of two large bore IV cannula. Full blood count group and cross match and coagulation profile is done. Fluid replacement is done with cross match blood or rapid infusers cell saver setup, which can include normal saline, Ringer's lactate. A stepwise approach to use of the uterotonic agent is as follows. First of all, we'll give oxytocin IV or IM, which is approximately 5 to 10 units. Then misoprostol is given 800,000 microgram. Symptometrine, which is a combination of ergometrine and syntocinon, is given. Repeat ergometrine 500 microgram IM slowly or IV push. Carboprost 0.25 milligram by IM repeated at intervals of less than 15 minutes is given with a maximum of 8 doses, and it is contraindicated in asthmatic ladies. If ongoing bleeding occurs, consider disseminated intravascular coagulation and replacement of clotting agents. Senior help interventional radiology or gynecology is the next step. Transfer to operating theater for surgical intervention, which includes iliac ligation, uterine balloon insertion, uterine artery embolization, and hysterectomy. Hysterectomy is the removal of uterus. Clear documentation of the sequence of events and cause of bleeding, debrief staff, family members, and patients. There are some points of the prevention, risk factors, and warning signs of postpartum hemorrhage. Prevention includes hemoglobin levels below the normal range for pregnancy should be investigated and iron supplementation considered. Prophylactic use of oxytocin for high risk patients. Risk factors of PPH, uterine atony, which is the most common risk factor for this hemorrhage, macrosomia, overweight babies greater than 4.5 kgs, multiple pregnancy, prolonged labor, oxytocin use, induction of labor, grand multiparity, polyhydramnios, antepartum hemorrhage, placental abruption. PPH is mentioned on page number 263 of 10 teachers, and it is an important topic from MCQ and SAQ point of view. Plus, sometimes it also comes in OSCE stations. The examiner sometimes asks you about doses of the uterotonics used in PPH, oxytocin and symptometrine, misoprostol, and the contraindication of carboprost. The examiner may trick you by asking that if a lady is asthmatic and she is using carboprost, then what would be the dose for it? Then you can say that an asthmatic lady cannot use carboprost because it is contraindicated.